I like to call the trifecta treatment method to how we attack what the problem is with the person, the functional limitations and the painful symptoms that the patient is dealing with, and we get rid of those with three big things. Number one is the manual treatment. When a muscle is in spasm, it tightens up, and then you start to develop metabolic waste and adhesions within that muscle. That limits and restricts the movement of that muscle. It causes pain when you try to use that muscle. It makes the muscle a lot tighter and less flexible, therefore pulling on the attachment points, causing increased tension on the tendon and oftentimes a lot of pain at the joints that particular muscle or muscle group crosses. So we use the deep tissue massage by pressing deep into the muscle, breaking up those adhesions. Your lymphatic system comes in and takes all that debris out. That's why they always tell you after a massage to drink a lot of water, because it gets dumped into your bladder and out of your system it goes. The next thing we do is to attack the inflexible muscle tissue that's there by doing a lot of stretching exercises, either contract, relax stretching or just low load, prolonged stretching to the muscle group. Once the muscle group can elongate, it again takes pressure off the tendon and the joint. And someone, let's say, that has an altered posture, let's say they can't flex or extend their elbow all the way because their bicep is so tight, we loosen up the bicep, we stretch it, therefore it allows the elbow to straighten out. It happens at every joint. The last thing we use is targeted strengthening exercises. Many times, if someone is weak in a particular muscle group, then they're not going to be able to perform that functional activity that relies on that muscle, i.e., you're trying to stand up from a chair, you need your glute muscles and your quad muscles. They're very, very weak. You're not going to be able to get up. What do? You compensate. You start to use your arms. You weight shift on the other leg more to get up. You're trying to go up and down the stairs. You try to get your left leg to propel yourself up to the next one. You can't do it. You got to use the railing. All these little nuanced compensations that you do throughout the day are because a particular muscle group is weak. When you get to higher functioning patients, such as athletes, you have a muscle group that's very weak, therefore increased force goes on another muscle group or a tendon or a ligament, then that ligament tears because a muscle group over here was weak, causing it increased compensation and tearing over here. So any kind of weakness in the musculoskeletal system must be addressed, and that's what we're experts in muscle, figuring out what is weak, what is not doing its job, and why you can't do certain functional activities. Along with that, of course, we do neuromuscular education, which is a lot of balance, proprioceptive work to make sure that your knee, ankle, hip, whatever, shoulder, the little receptors at the joints are quick to respond to, provide stability. We do gait re-education, which is teaching you how to walk again without limping. So a whole myriad of things fall into that trifecta treatment regimen that we use at PKL Physical Therapy, and that's what sets us apart from a lot of the PT practices out there.